Okay, let's discuss now the part 4 of your pharmacodynamics, which is the mechanism of action, mechanism of drug action, mechanism of your drug action. So drugs, again, they act by binding to receptors. Binding of the drug may activate the receptor, they produce a response, or it may inactivate a receptor. So they are blocking the response. We have the concept of your agonist and your antagonist. So the different activity of many drugs is determined by the ability, the strength of the drug to bind to specific receptor. So the better the drug fits to the receptor site, so the more active the drug is. So different mechanisms of your drug action includes, we have 7 mechanisms actually. Number 1, we have your mechanism of your stimulation. Okay, number 2, we have your depression. Another mechanism that you should know of is your irritation. We'll go one by one. Okay, and then number 4, we have your replacement. Number 5, your cytotoxic. Okay, your cytotoxic action. At number 6, we have your antimicrobial. Okay, antimicrobial action. And lastly, number 7, your modification. I will just write it above, okay? Adjacent to your stimulation. Modification of your immune status. Modification of your immune status. So there are seven mechanisms of your drug action, which includes your drug stimulation, depression, irritation, replacement, cytotoxic action, antimicrobial action, and modification of your immune status. Okay, let's go with first. Let's discuss your stimulation. So number 1, we have your stimulation. Okay, what about, sir, your stimulation? Stimulation actually obviously derived from the term stimulation, stimulates. So the drug that what? That stimulates, obviously. A drug, okay, that stimulates or enhances, okay, enhances a particular intrinsic activity, So this drug selectively enhance the level of activity of a specialized cells. So this is the process of your stimulation of your cells. Let me give you an example, class. Stimulation, we have your adrenaline or your epinephrine. Obviously, your adrenaline or epinephrine, it stimulates what? Stimulates the heart. That's your stimulation. Your pilocarpine stimulates your salivary gland. That is a stimulation. That is an example. Good example. Pilocarpine stimulates what gland? Your salivary gland. Salivary gland. As simple as that. That's your concept of your stimulation. Another concept is your depression. Okay, your depression. Stimulation, the keyword there is stimulates or enhances a particular activity. While your depression, obviously, this particular drug selectively what? Selectively depress a particular activity, an activity of a specialized cells. Depress a particular or specialized cells. What would be a good example, class? A good example of your depression, obviously, is your barbiturates. Barbiturates. It causes what? Barbiturate is a CNS down. Causes your CNS depression. And you will encounter those, class, okay? When you reach your third year or even your fourth year. So it's very important to know the basic concept. How about, sir, your irritation? How about your irritation? If we say irritation, the drug creates selective Drug creates selective noxious, undesirable, noxious effect on a specialized cells. A good example, obviously, irritation is your astringent. Another mechanism is your number 4, we have your replacement. What about your replacement? Replacement uses, it is simply natural, use of a natural metabolites. Use of a natural metabolites, hormones in deficiency states. So it replaces essential body compounds, natural metabolites, hormones. So the action of this, the mechanism of your replacement is simply to replace essential body compounds. A good example of your replacement is your insulin, which is obviously used for diabetes mellitus. Your iron could be a good example. It can be used as a replacement to patients suffering from anemia, you patients diagnosis of a Parkinson's disease. You can make use of the replacement of your levodopa. It replaces an essential body compounds. And number 5, we have your cytotoxic action or mechanism of a drug. So this cytotoxic, it selectively kills, kills invading, parasites, kills invading parasites, cytotoxic. An example of which is you have your chloroquine, cyclophosphamide, chloroquine, penicillin, and so forth. That's your cytotoxic. It kills invading parasites or cancers. Invading parasites or cancers. Sorry, I didn't write that one. Okay, number 6, we have your antimicrobial. We have your antimicrobial drug. So this mechanism prevents, it will inhibit or kill invading. For cytotoxic here, it will kill infectious organism that is already present. Infectious organisms. And then the last mechanism of drug action is your modification of an immune status. This modification, again, obviously, it will modify, it will enhance. It's either enhance, modify, or depress the immune system. A good example of the modification of your immune status is we have your, what do you call this, interference and your methyl peroxide. So those are the different mechanisms of your drug action, which includes 7. Again, we have your stimulation, depression, irritation, replacement, cytotoxic action, antimicrobial action, and modification of your immune status. So that is what we call your mechanism of your drug action. Now, another important concept of your pharmacodynamics, aside from its aspects, the mechanism of a drug action, the types of your drug receptor, it's very important to take into consideration the different therapeutic effect. So this is 5. Okay, therapeutic action of drugs. What are the different therapeutic action of drugs? Meaning they are the therapeutic, desirable actions of a particular drug. Number 1, we have curative. we have your curative. Obviously, curative, it will cure the problem. It will resolves the problem. A good example of your curative, we have your antibiotic for infection. It will cure, it will resolve the problem. Number two is your palliative. You should know this basic concept, class. If your curative resolves or simply solve the problem, cure the problem or particular disease, palliative, it will just only alleviate, it will lessen only, alleviate the signs and symptoms of the disease. It will only alleviate, it will only lessen, okay, the signs and symptoms. A good example is a morphine. Morphine. Para saan ang morphine? Morphine. Number 3, therapeutic effects substitutive. Palliative, curative, substitutive. What is your substitute? Substitutive. It will replace. Okay, replaces the particular what? Hormone or the missing enzyme or the hormone. Curative, it will resolve the problem. Your palliative, it will just lessen or alleviate. Your substitutive, it will just replace the hormone that is actually missing or the enzyme that is lacking to the patient. A good example is, obviously this may sound cliche, but this is a good example. Insulin for diabetes mellitus patient. And another therapeutic action of a drug, we have your supportive. Your supportive. We say supportive, it will obviously it will support body functions. It will only support body function until the treatment can take over or the body can compensate. First, it will support the body function until the body compensates or until the treatment they can take over or the body can compensate. What is a good example of a supportive therapeutic action of a drug? A good example, class, is good example is an epinephrine. Your epinephrine by titrate. Epinephrine by titrate for low BP. That is a supportive, okay, therapeutic action of a drug. It supports the body until the body compensates or until the treatment can take over. Another number 5 is we have your curative, palliative, substitutive, supportive. What is the other one? Restorative. Yes, very good. Okay, we have your restorative. Keyword for restorative, obviously it will restores the body. It will restores the body back to what? Back to health. Restores the body back to health. What is a good example? Supplements, vitamins. They are restorative in nature. Vitamins, they are restorative in nature. So that is about the therapeutic action of a drugs, which includes curative, palliative, substitutive, supportive, and restorative. Another concept of pharmacodynamics that is very also important, we have your pharmacodynamics interaction. Pharmacodynamics interactions. What about, sir, your pharmacodynamic interactions? So they're those that result in additive, synergistic, or antagonistic drug effect. Antagonistic drug effect. Now, Let me just illustrate this, class. This is very important. What is the difference between your additive and your synergistic? If we say additive drug effect, it is actually the sum. Additive, it is the sum of the effects. It is the sum of the effects of the two drugs. Sum is the totality of the administered drugs. When two drugs are administered in combination and the response is increased, obviously that is beyond what either could produce alone. So this can be desirable or undesirable. I'll repeat. Additive drug is when the two drugs are administered in combination and the response is increased that is beyond what either could produce alone. So simply your additive drug effect, two drugs of the same classification. Remember that, class. Your additive, two drugs of the same classification. It will increase the effect that is beyond what either could produce alone. What is a good example of your additive? A good example of your additive is your aspirin and your codeine. Aspirin and codeine, they are analgesics that work by a mechanism, but they can be given together for increased pain relief. That is a good example of your additive drug effect. Mathematically speaking, additive is simply illustrated as what? 1 plus 1 equals 2. That is additive. Two drugs of the same classification are given, producing increased effect response that is beyond what either could produce alone. That is an additive. How about, sir, your synergistic? Okay, your synergistic drug effect. What about your synergistic? Your synergistic, that is the clinical effect of the two drugs given together, is substantially greater than that of either drug. So meaning two or more drugs are given together, one drug can have a synergistic effect on another. Paano to, class? Your synergistic, it is simply the clinical, effect of the two drugs given together is substantially, okay, it is substantially greater than that of either drug alone. So what is the line of demarcation between additive and synergistic? Drug alone. In additive drug effect, class, it is the sum of the effect of the two drugs. Pinagsama mo lang yung dalawa. Okay? When two drugs are administered in combination and the response is increased that is beyond what either could produce alone. Ang synergistic, that is the clinical effect of two drugs when given together, when combined together. It is not just only increased, it is actually greater than that of either drug alone. So when two or more drugs are given together, one drug can have a synergistic effect on the other. It will potentiate the therapeutic effect. What is the difference now between additive and your synergistic? Additive versus synergistic. Your synergistic, class, your additive, again, your additive, two drugs of the same classification. Okay? In your synergistic, two drugs of different classification. Two drugs of different classification. Now, let me give you an example. Like, for example, in your antibiotics, You know that ampicillin, amoxicillin can be given without their inhibitors. Sometimes doctors we will order ampicillin with sulbactam, amoxicillin with clavulanate. So your sulbactam is a bacterial enzyme inhibitor. Normally, ampicillin can be given without inhibitors, but sometimes doctors would order ampicillin with sulbactam. Why? If you gave that bacterial enzyme inhibitor, if given, it will inhibit bacterial enzyme activity. So this bacterial enzyme activity, it enhances the effect, it broadens the spectrum of activity of the antibacterial agent. Mathematically speaking, additive is 1 plus 1 equals 2, while synergistic 1 plus 1 equals 3. Mas mataas kaysa dun sa ine-expect mo. Mas mataas pa sa mas mataas sa ine-expect mo. It will enhance, it will potentiate, it will broaden the effect or the activity of a particular drug. That is what you call a synergistic effect of a drug. That is what we call the synergistic effect of a drug. Another, aside from your additive, your synergistic, letter C, your antagonistic, obviously from the term alone, antagonistic drug effect. What about, sir, your antagonistic drug effect? That is actually illustrated as your drug-drug interaction. That is actually illustrated as your drug-drug interactions. So when drugs with antagonistic effects, they are administered together, one drug reduces or blocks the effect of the other. Yan. One drug. So when drug with antagonistic effect, so you gave a particular medication, and this particular medication, A and B medication are given, and drug A has an antagonistic effect. They are administered together. Drug A will now reduce or lessen. One drug reduces or it will blocks the effect of the other. It will block the effect of the other. It could be actually desirable or non-desirable. This is very important, class. I'll give you an example, class. I'll give you an example. In morphine sulfate, okay, let's like for instance, your morphine sulfate. In a morphine sulfate overdose, we are giving naloxone. We're giving a naloxone. Naloxone is given as an antagonist. Naloxone is given as an antagonist in order to what? In order to block narcotic effects of your morphine sulfate. That is what we call your antagonistic. In morphine sulfate overdose, what is the antidote? We are giving naloxone. Why should you give a naloxone? Because naloxone is given as an antagonist. It blocks the narcotic effect of your morphine sulfate. Another example, class. Another example. In cases of your heparin overdose. Cases of your heparin overdose. What is the antidote of your heparin? Okay, you will expect that the physician will order a protamine sulfate. Why do you give protamine sulfate? It is actually given in order to block, to reduce the effect of your heparin. So your role here as a nurse is very, very important. The role of a nurse is very important. Okay? What will you do, class? What will you do? The patient is taking over-the-counter drug, herbal medication. They can interact with each other. Remember, class, it is a myth that interactions occur only with prescription medications. What if this particular patient class is a diabetic patient, and then this particular patient receiving insulin, and then this patient approach you, nurse, I wish to drink noni juice. I want to drink noni juice. So what will you do as a nurse? Your patient approaches you, I will drink noni juice. Remember, you have to remember, it is a myth, class. It is a myth. Hindi po totoo that interaction occur only with prescription medication. Remember that prescription medication, over-the-counter, herbal medication, they can interact with each other. So if a patient approaches you that he wishes to drink noni juice, you have to what? What is your role? Yes, you have to notify the physician. Notify the physician. Because this noni juice or any medication may whatever be the nature or kind of that medication na hiniinom niya, it may be herbal, over-the-counter prescription, they can interact with each other. It is a myth that interactions occur only with prescribed medication. So if this patient approaches you, I want to drink noni juice, you have to report to the physician, notify the physician. Because this noni juice might interact with the medication that is being ordered by the physician. O katulad yan, mahilig tayong uminom minsan. You are diagnosed with this kind of diseases and then you heard in a commercial about the Santon Plus, iinom ka ng mga tinatawag natin, what they call this, yung kulay violet na nabibili around sa Mindanao. Anong tawag doon? Mangosteen. Okay? So you're taking this particular supplemental. So as a nurse, you have to notify the physician so that the physician can know if this particular supplements or drug can interact with each other to the prescription drug na ino-order niya. Because sometimes those particular medication na iniinom ng patient natin, it can actually mask the signs and symptoms. Pwedeng sabihin nila, ay nawala na yung cancer ko. Ay nawala na yung ganito ko. Eh ang nangyari lang pala, minas lang pala niya. Sinugar coat lang pala niya. So remember, it is a myth that interactions occur only with prescription medication. Take note, prescription, may it be prescription, over-the-counter, herbal, they can interact with each other. So your role here is very important. What would be your role as a nurse? You have to notify, you have to report to the physician. You have to report to the physician. Another important, aside from the antagonistic, synergistic, additive effect, let's include class another important. Number 4, side effects. Okay, your side effects of the drug. Your side effect of the drug is described as a secondary effect. Secondary effect of drug therapy. Okay, secondary response. Okay, secondary effect of drug therapy. Because the primary response obviously is the desirable or the therapeutic effect. So side effect is the secondary effect of a drug therapy. Secondary effect of a drug therapy. So all drugs have side effects, obviously. Even with correct, kahit patama yung dosage mo, all drugs have side effects. Even with correct drug dosage. Side effects occur that can be predictable and range from inconvenient to severe to life-threatening. So it is important to know that the occurrence of side effect is one of the primary reasons why patients stop taking their prescribed medication. Isa yan sa mga dahilan kung bakit hindi tinutuloy ng mga pasyente mo. Once na nakita nila, ay, ganito pala yung side effect niyan, hindi na nila itutuloy. They will stop, they will halt taking that medication without even knowing because they lack knowledge about the side effect. That it's normally occurring, it is actually occurring. Yun yung talaga yung side effect ng medication. So it is very important, class. It is a very important role of a nurse. Okay? Teaching about the side effect is very important. Encouraging them to report side effect is very important. So your important role here is, class, teaching the patient Okay, teaching patient about the side effect. Baka mamaya makikita nila, ay, ganito pala yung side effect, titigil ko na. Hindi nila alam, normally, that's the side effect of that medication. Encourage them to report, obviously. Your role is very important here. Encouraging them to report side effects. I'll give you a good example. So your patient, you admitted, Mang Ambo, patient admitted in the hospital with a diagnosis of your tuberculosis. We all know that one of the drug that is given to a TB patient is your rifampicin. And the side effect of your rifampicin, it causes orange sputum, pati ihi mo, ultimo mukat mo, kulay orange. So if this particular nurse does not even educate the patient about its side effect, kunwari si Mang Ambo uminom ng rifampicin, tas ngayon pag-ihi niya kulay orange, na-alarma ngayon si Mang Ambo, natakot siya. Kasi hindi niya alam na yung side effect. He's not aware. He's not even aware. Tas nung umubo siya, kulay orange, tas sabi niya lalong lumalala yung case ko. Which is actually, that's a side effect. Ngayon nung umiiyak siya, may namuong muta. Pag muta niya, sabi niya, nasyakira si Mang Ambo. Shucks, bakit ganito? Kulay orange, pati yung aking morning glory. So, takot na takot siya. So, ang role mo doon, class, very important yun. You have to teach the patient about side effect. Sasabihin mo sa kanya, you have to teach about the side effect that those are normal side effects. See? That's very important, class. Another, number 5. Adverse effect or adverse drug reaction. Obviously, your adverse drug reaction, they are unexpected. They're actually unintentional. Okay? Reactions to a drug therapy that occur at normal drug dosages. It can be mild to severe, which includes anaphylaxis or cardiovascular collapse. Remember that your adverse effect, they are always undesirable. Though they are unintentional, they are unexpected, they're always undesirable. So what will you do? It's your role. If the patient suffers anaphylactic, that's undesirable, obviously. So your role here is to report to the physician. You have to report to physician and you have to what? Document. You have to document. Why do you need to document the adverse effect? Because they represent variance from your planned therapy. There's actually a deviation from your set planned therapy. So you need to report to the physician and document, obviously. And number 6, we have your drug toxicity. Drug toxicity, it occurs when drug levels exceeds, exceeds the therapeutic range. So it may occur secondary to overdose, may it be intentional or intentional, or drug accumulation or drug toxicity. So this is very important to determine the therapeutic level of a drug, the toxic level of a drug. That's why we discussed about the therapeutic effect of a drug in the previous videos, and then the toxicity level, the lethal level. So the factors that could affect drug toxicity is your diseases that is obviously existing, genetics, the age of a person. Like for example, in patients with liver cirrhosis, there will be accumulation of your ammonia. And we all know that ammonia is a toxic, that is an obnoxious substance to the body. So we need to administer a particular drug in order to excrete those waste product. Okay, so drug toxicity again, it occurs when drug levels exceeds the range. Therapeutic range. So that is about the therapeutic effect of a drug and the side effects, adverse effect, and your drug toxicity.